you mentioned mental health there. I'm just wondering, does that include the work capability assessment in that with the mental health as well? Because I've just recently failed that assessment.
So have I.
Just through mental health.
There's a number of things we want to do.
And just you say your bit too. You're sitting together by chance or
by chance?
Okay, well, say what you were going to say then. Go on.
Well, basically, again, on mental health, I agree. It's so important. The NHS is an absolute shambles for mental health at the moment. I applied for NHS counselling about, I think, probably the end of 2015. My first appointment is next Tuesday.
Yes.
My next appointment is next Tuesday. I've been waiting a year and a half for this, and I have suffered so much over that year, in part because of the work capability assessment. And let me tell you, I'm partially sighted as well. I'm partially sighted. I have mental health problems, and also I have other issues, so jaw issue. And I went into my assessment, and I was asked in detail about suicide attempts, and I came out crying because I was so upset because of the way I was treated by that nurse. And she came out after me. She'd forgotten to measure my eyesight. I'm partially sighted. She found time to just insult me, basically, by asking for all these upsetting details to the point I cried.
Let the Prime Minister answer.
Look, I'm not going to make any excuses for the experience that you've had. That's why I think it is so important that we do deal with mental health. Now, both of you have raised two different issues. One is how we deal with mental health issues in the health service, and the other is actually the work capability assessment. And this is something where we do look at improving how that assessment is taking place. But I know that the issue of mental health is particularly difficult one to address in terms of those work capability assessments. On the National Health Service and the other things we want to do with mental health, I mean, one of the things I want to do is ensure that there is better support in schools, so that we have individual members of staff trained in schools who are able to better identify mental health problems and then know how to address them. And I was talking to a young woman only at the turn of the year who, in school, said nobody'd really known what to be able to do with her because of her mental health problems. And so she'd suffered as a result. If we can give people the support they need at an earlier stage, it's better for everybody. Okay. But